Hi guys, we are at Swiss Avenue Birth today for my 24-week appointment. You guys are gonna meet my midwife Amy and we are gonna give you guys a tour of the birth center. So let's go.
Hi, welcome to Swiss Avenue Birth. I'm Amy. This is Swiss Avenue Birth. We are a birth center and midwifery practice, so you can see us throughout your whole care. You can have your baby here at the birth center. We're gonna show you the whole space. Come on back.
We love it here.
So we have a library. This is a lending library, so you can actually check out any books you want during your care. Lots of great tips and tricks. Family room, although we recommend you keep it simple and invite only those that you really want in your birth space. We do have 2 beautiful birth suites. Although usually when you come into care, you are the only person here. Most of the time you call us in the middle of the night. Labor happens when you're sleeping, you call us wee hours of the morning. You'll come in, we'll labor together for as long as you need to labor, then we'll meet your baby together. You can walk freely throughout the whole building. As I said, it's often just us together, so it feels very intimate. You're meeting the midwives you've seen throughout your care. So it's nobody coming into triage to check in on you. It's the faces you know. We've seen you through all your prenatal. We've done all your lab work. We've gotten to know each other really well. Our appointments are 45 minutes to an hour, which makes it really different. We talk about more than just the growing baby. We talk about your health, your emotional state. We always err on the side of more natural, but we're looking for any risks that might be creeping in throughout your care.
Yes.
When you come into the space, you can choose your birth suite. We'll look at both of them. Both of the suites have a great birth tub. You can labor freely in that water. Many people find that laboring in the water actually gives you enough comfort to proceed with labor and have your baby. Sometimes you don't have your baby in the water. Sometimes you get out and you move to the bed, you're squatting, you're standing, you're walking stairs throughout. Maybe you're in the shower. Whatever makes you feel most at peace and strongest in labor is the place to birth your baby.
Yes, and it looks so beautiful in here and the bathroom. I love it.
Thank you. It is a really beautiful and serene space. I think that it feels very home-like, which is nice, so that when you come in, you feel like you're kind of in a bed and breakfast rather than in a sterile setting. When you do come in, it will look a little different because we do set up urgent and emergent supplies, but we kind of tuck them away. So there's oxygen behind you. If your baby needed a little support or you needed support in labor, we're going to be able to support both of you. We are trained in neonatal resuscitation, but most people who come into labor have been with us throughout care, and we know that they're healthy and their baby's healthy. Actually, all people who come into labor are. So when your baby's healthy, when you've been healthy throughout your whole care, it's very unlikely that something happens. Many things creep in through pregnancy, which is why we're seeing you so long in each appointment and really asking you all the questions. So you come in, you're healthy, your baby's healthy, we're monitoring you with a Doppler. We do intermittent fetal monitoring here, which is actually evidence-based for low-risk women. So we are checking on your vitals and your baby's vitals. You have your baby, you can birth your baby anywhere. Like I said, you could be in the tub, your husband can catch your baby, you can catch your baby. Your baby goes right to your chest and then y'all snuggle into bed. Your baby's gonna stay on your chest throughout those whole early hours. We'll monitor you and your baby while y'all are together as a couple. Your cord is usually pulsing for a good 30 to 45 minutes. We actually don't talk about cutting the cord until you're ready to, and that's after your placenta's been delivered.
Yes. And I know a lot of hospitals, they don't even do that unless you really ask for it.
I mean, the standard of care for delayed cord clamping in hospitals is 1 minute. So in 1 minute, some of that blood passes, but a third of your baby's blood volume is still in the placenta. And studies have shown that if you allow that to pulse through, they're getting that oxygenated blood, that iron-rich blood, and those stem cells that are left in your placenta. So the longer you do it, there's benefit. We find that babies who are allowed to have their cord pulse have very good outcomes. They are not anemic, they are not jaundiced, and that's been one of the worries that people have thought was out there, that your baby might be overly jaundiced because they get more blood. But that hasn't really proven to be the case in our care, so.
That's amazing. And then maybe you can tell us a little bit about the herbal baths you guys do here.
So after you have your baby, you will be offered an herbal bath. You and your baby can soak together. Our herbs are boiling throughout care, and they smell really good, but they're also really soothing. Lavender, chamomile, calendula, things that would be soothing to your body and soothing to your nerves and help you rest when you get home. Some people don't want to put their baby in, and that's totally fine. They can stay next to dad and do skin to skin with dad during the herbal bath. Dad could get in the bath and y'all can do a whole herbal bath together, or you can just enjoy your herbal bath. But if you do put your baby in, you've seen probably lots of beautiful pictures on the internet of these herbal baths. You can bring flowers. It's really relaxing and soothing, and you're not scrubbing your baby, you're just soaking together.
Yes. Oh, it's amazing. My husband would definitely not get it.
Most of them don't.
Office right now. We are going to ask her some questions. We also had a few questions that came in from Instagram, so we're going to get to know her a little bit better. And I guess if anybody has any questions after this, you can always post them in the comments, or you can.
I'm happy to answer.
Yeah, you can message either one of us.
Sure.
And I'll make sure it gets to the right person, and we'll answer all your questions.
Yeah.
Okay, so let's see. Question number 1. Why a midwife? What is the difference between a midwife and an OB?
So really the difference between midwifery care and OB care is the relationship. Historically, midwives have been the care providers for women in pregnancy and childbirth. And in this country, that shifted in the late 1800s, and we've had a much more medicalized model. And in the medicalized model, you're seeing an OB who is also seeing people who are very sick, people who may have gynecological issues, things that are outside of pregnancy at any stage of life. In midwifery care, you're seeing us with a smaller group of women, and we can really spend more individualized time with you. We see each of our clients here for 45 minutes to an hour. So that's a long time that we get to know each other. We're talking about health, your overall well-being, questions you have about pregnancy, postpartum, how to have a better birth. And then we're doing your clinical care as well during that appointment. So we're still checking in on baby. We're listening with a Doppler. We're checking in on your well-being with your vital signs, your blood pressure. We're asking all the questions to rule out any medical conditions. We're doing routine blood work. We offer all the standards of care here at our facility that you would have at an OB. But most of our time together is really about relationship and tailoring care to what you as an individual want. Because all of us want something very different in our labors and births. And getting to know each other gives you that sense of peace and ease. So like I said downstairs, when we come in, we already know each other. We know what you wanted.
Yeah, and that's very true. Actually, I remember I've been poked by you way more times than I've been poked in this whole life. But yeah, it was all for a reason.
Hopefully not too terrible.
No, it was great. It was great. Okay, well, that's great. Let's see another question. Why natural birth when it is so easy to go to the hospital now and get an epidural with no pain? And I can actually say that even most of my clients that I photograph, almost everybody is either getting induced or having an epidural. And you know, just being in this industry for a while and getting to know everybody's stories, it was always a question of mine. Like, why does everybody need to be induced? Why is there, you know, why does everybody go for the epidural, and why is this really the easy way out?
Well, let's start with induction. A large population of women in hospitals are induced. They start off labor with an induction process, and that does make your labor feel a little bit different. Pitocin contractions are not natural hormones. It is a synthetic hormone that's introduced to help stimulate labor. And that means the contractions are coming on in a different way. Instead of easing up like you're climbing a mountain and you get to a peak and then you fall slowly to the other side, or walk slowly to the other side, your contractions come up like a wall and just are hard and heavy. That's hard. That's really challenging. It is a very challenging thing to have a natural, or let's not say natural, let's say physiologic labor when things are introduced from the beginning. Even if it's just like unknown faces, unknown surroundings, that creates anxiety in your body. You're in a space where you've never been before, usually in a hospital setting. Here, when you come here, you've been to the birth center a lot of times. You feel a little more comfortable. If you're getting Pitocin, if you're being induced, you're having contractions that start in kind of an unnatural way and feel different. They feel a little bit stronger from the beginning. So there's not that ramp up where you can rest. That makes it tough. Fatigue, exhaustion, anxiety all increase the feeling of pain, the sensation of pain. And so I think when you are in a situation where that is what's offered, it seems like the right answer. But epidurals do come with risks. There's a whole list of things. Risks and benefits is what we teach you to weigh out here. We talk about evidence for every single thing that we offer. And you should read all risks for everything that's offered to you, whether you're here or in a hospital setting. There are things that can happen during labor. Your baby could feel distress from the medications. Your baby could feel distress from lack of movement. There are benefits. Maybe you've had a very long early labor and you need to rest. But weighing those out and really knowing what risks and benefits are really the first step of informed consent. And sometimes that's not done as well as it should be done.
Yes, and that's true. And I mean, of course, if something happens and you do need to get induced, you do what you gotta do.
You weigh the risks and benefits of every single thing. So if there's a medical need for something, consider it heavily.
Absolutely.
If there's not a medical need and you are having a physiologic low-risk pregnancy and low-risk labor, then really weigh those risks heavily because the benefits might not outnumber the risks.
Yes, and I think this actually ties into the next question that I wanted to ask. Someone asked this on Instagram. My doctor said, let's schedule your induction even though my baby is healthy and I'm not high risk. I truly trust my doctor, but I want to trust my body too, that it knows what to do. What should I do? What is there a reason why I should or should not get induced?
Yeah. So I think there's a big reason that you shouldn't get induced, but I'm practicing a physiologic type of birth or labor and pregnancy management. So the biggest risk for induction is that it might lead to an outcome that you do not want,
which is a C-section. Yes.
And our C-section rate, unfortunately, in this country is sky high.
Yes.
Over 30%, up to 45% in some hospitals. So that's another thing to weigh risks and benefits when you're choosing a birthplace. Really think about how often they are doing a vaginal delivery, if that's what you want.
Yes, very good. Another question that I had come in was this mom asked, I'm over 35. How safe is it to have a home birth?
Depends on how healthy you are. So we find that most women who come into our care, whether they are 29, 34, or 38, are pretty healthy. If you're able to move your body, you're not on medications, you haven't had numerous surgeries, you don't have big risk factors presenting outside of your age, then we find it is a safe option. We're still going to continue to monitor throughout care. There are some things to consider. There are a lot of things to consider in being over 35 and getting pregnant. But once you're pregnant, really, if you have been low risk beforehand, typically you stay low risk.
So pain management. This question actually came from a friend of mine. She said her contractions started 2 days before she delivered and they were insanely painful. Is there anything that you guys do here that will help with that, or what pain relief is available?
Yeah, so there are a lot of things you can do to help either move that forward into an active labor pattern. It's called prodromal labor. It's a very hard thing. Typically your baby is trying to get in a good position, your body's trying to help, and so you have contractions that kind of start and stop. It can be really exhausting. And so if you're in our care, because we're having such a close relationship and you're able to communicate at any time for any needs, then we would help you with movement, try to get your baby into a better position, other like chiropractic care, massage, things that might help your muscles and your tendons relax so that you can open up space. That sometimes turns labor completely off, and then you can restart. Or maybe your baby just needs a little nudge and then you get into labor. So what we would try to do in that case would be to either get you rest or get you into active labor. If we cannot do those two things, then yes, there is an option for pain management here. We have nitrous oxide. You can use that. We find it best for short-term use when you need a little rest. You need some sleep and reprieve. And it works well to kind of get you through to the next stage. But I will go back.
Okay.
The water, getting in the tub.
Yes.
That is really, really helpful.
Even taking a hot shower while you're out, while you're at home.
Absolutely.
Okay, let's see. In what case do you send someone to be monitored by an OB and they can't deliver here?
There are risk factors that would rule you out of care. So while we're doing those longer appointments, we're always asking the questions that would clue us into something developing along the way. If you developed one of the conditions that are outside of our scope, preeclampsia, if you were gestational diabetic and you could not control it with diet and exercise. So the diet, we're going to talk lots about. I've never had anybody transferred out for gestational diabetes, but it is a possibility. If it was not controlled, then that would put you at a higher risk level. We do support twins if they are in a good position and they have 2 sacs and 2 placentas. If you have a twin pregnancy, I feel more comfortable doing co-care and having an MFM that I trust see you as well. So there are times when we can keep you in care when you have co-occurring risk factors, and there are times when we need to find another provider for your safety or your baby's safety. We have a list of providers that will accept our transfers, so you're not out in the cold on your own. If something happened during labor and it necessitated transfer, our birth center is 3 blocks from the hospital. We would go to the closest hospital, and we do have a relationship with them and can transfer directly into labor and delivery, which is kind of unique for most midwives. It's nice to be that close, but we rarely go there. It's only about 2% of the time that we have an urgent or emergent transfer in labor. So transfers happen less often in labor, but it would be more likely to find a risk that we need to look deeper into either at intake or during pregnancy.
And I believe you said a while back when we were talking about this, that even in the case that you would need to be transferred to the hospital, you guys go with the patient.
Yes, we do. We would go with you. We're going to be your support team, and then we bring you back. You're still going to come back for your postpartum. We're able to see you and baby together. We can manage well baby care through 6 weeks. So we see you as a couple. We support with breastfeeding, with jaundice, with pain and discomforts, any conditions that are normal in the postpartum period, we can help support.
Perfect. And that was actually the next question. What about jaundice?
Yeah. So we are able to see your baby throughout their whole 6-week postpartum care as long as they stay healthy. There are 2 types of jaundice. There is physiologic jaundice, which is a condition that happens usually after 24 hours. It used to be called breastfeeding jaundice, but it's physiologic jaundice. It's a form of jaundice that is typically considered more normal and easily managed. And then there's a type of jaundice that's called pathologic jaundice. Pathologic jaundice is concerning because it often is about blood-to-blood conditions. Maybe baby was exposed to a different type of blood. There are other things at play. And that comes on early. So that would happen in the first 24 hours. So we're going to give you really detailed information on what your baby should be doing in those early days. We're going to see your baby at 2 to 4 days. We check in on the phone at 24-ish hours. We're available to you on call. If your baby were to start to have any of the signs of jaundice in that first 24 hours, we would refer you to your pediatrician immediately, or even possibly to NICU, depending on what we feel is needed. If your baby is outside of that 24 hours, which is usually the case, then your baby could be managed here as long as they are at a mild level of jaundice. We can take blood from your baby. We can check the levels of bilirubin. We can order lights, but we would typically refer to pediatrician if it got outside of that mild level of jaundice.
Perfect. Okay. One other question I have here is about postterm pregnancies. How far is too far?
Yeah. So there are some things, people have different opinions about this, and there are some things that kind of keep us in a certain timeline in Texas. We have laws in Texas as midwives, as licensed midwives in Texas. We are only able to deliver outside of a hospital between 37 weeks and 42 and 0. So once you get to 42 and 0, we need to get you into labor, or our law says that we must collaborate, which means a physician would need to see you and say, sure, stay pregnant, or we must transfer. So we work really hard to have babies within that time frame through health and wellness and our relationship, lots of nutritional tips. There are some things that you can do to help encourage labor that are very non-interventive, natural. And then if you get close to the 42 weeks, we start to talk about some other things that we can do. We would absolutely try to collaborate if that's what you want. But again, we're going to weigh risk and benefit.
Yeah.
Because there are increased risks statistically after 42 weeks. And that's why the laws are in place.
And to wrap this up, if you can tell us about the services, classes that you have available here.
Sure.
I know placenta encapsulation is one of them that I plan to do. So if there's anything else, or maybe if you want to talk a little bit about that, or anything else that you want to share about what you guys do here.
Yeah. So once you come into care, we do have a resource list for pretty much everything anybody's ever wanted to do. If you come up with something new, I will find that person for you. We really consider ourselves part of your team and your birth planning team. We are talking a lot about your birth and your birth planning and the options throughout your appointments because we're spending so much time together. But we do have a couple times that we get together. We have the orientation or the group consult that we do each week. Any of you can come. We have a group for birth planning and postpartum prep that we do around 32 to 36 weeks, which you will be coming to, and we'll talk about all the options. Placenta encapsulation. You can take your placenta home and bury it. You can do all sorts of things with your placenta. We offer the full gamut. You can do cord blood banking. You can make chocolates out of your placenta. So many options. We have postpartum doula care that we can include. We have lactation consultants that we can send to your home. We have a full list of photographers, amazing resources for birth if you want your birth videoed or photographed. And we have doulas that will come to your home before you're in active labor and help support you and then be part of your birth. We have postpartum care options. We can do IV therapy. There's just a whole list of options.
Yeah, so it seems like everything's available, which is awesome.
Try to make it easy here.
Yes. Well, thank you so much for taking the time to answer all these questions.
Yes.
It was so wonderful to get to know you and a little bit more about your practice and to even tour this space.
Thank you.
And I think we're going to wrap this up with
listening to your baby.
Listening to my baby boy.
So just on that note, every time you come into care, we will, of course, take your vital signs, but your baby's vital signs are really your baby's heartbeat. So we listen to your baby and measure your belly. So
let's do it.
Okay.
He likes to hang out on this side.
Yeah, this is his little back right here.
His back?
How can you tell?
So if you walk up, you'll feel this is kind of empty, and then you walk down here and you'll feel his whole little back. So go all the way down.
So he's kind of facing with the back towards?
Right now, his little butt's right here, and his little head's probably right there.
No way!
So I'm gonna think I'm gonna get him right here. We'll see how that works out for us.
Let's see.
I did get him until he ran away. Lots of movement happening. There he is. 140s. And lots of movement.
He's moving a lot.
He's trying to get away. 146 to 149. and running from our Doppler.
Yeah.
They often run away from our Doppler. It's not their friend. It's an
I can
invader.
feel him rubbing on the belly.
I'm trapping him now.
I can feel that too.
And he's trying to get away. 139 to 148.
Aww.
We won't scare him anymore. But. Sweet baby. But yeah, he's definitely more on your right side right now.
Mm-hmm.
He's getting bigger.
Yes.
Perfect.
Well, thank you so much, Amy, for answering all our questions and giving us a tour. And we got to know so much more today.
Yeah.
And maybe you can just tell everybody where they can find you
Sure.
at.
We are at Swiss Avenue Birth and Wellness. You can find us on the internet or on any of the social media pages. If you want to call us, give us a call at 214-774-9000.